Hello, my name is Alex Goulis, and this is my sister Eleni Goulis, and we're talking about thalassemia today.
Thalassemia is an autosomal recessive blood disorder.
Thalassemia is an illness that's caused by the inability of red blood cells to produce hemoglobin.
We went to the 4-month checkup, and John Patelis, a friend of ours from church who knows about thalassemia, looked at Alex and said he's hemolyzing, which I didn't understand what that meant.
It was a pretty devastating day, none to speak of.
It's a disease that affects children, like Alex.
1, 2, 3. Take a deep breath for me.
I think that I'm different by what I have to go through and how I deal with needles.
We'll take the little cap off here. Sterile needle.
Treatments for thalassemia include chelation, an intravenous medication that must be worn 12 hours a day.
And you'll see. It's okay. So leave it there like that. Oh, where's my other gauze?
There's a maturity to him, or a level that that most kids that age don't have, or either don't possess. I don't think he never acts different. You know, we've tried to make him as normal as possible, except for the fact that he has to go once a month to get his therapy, and then at night he wears his medicine.
And then pull it out the top, and then he won't even bother with it anymore. That'll be the end of it. And clip it. And that stays on until tomorrow morning. Right before school, we pull it out.
Patients with thalassemia must also receive blood transfusions every 3 weeks.
Chronic transfusion means the receiver of a red blood cell transfusion generally once every 3 weeks to 4 weeks in order to keep them from trying to make red blood cells and keep their red blood count up. The reason you want to keep them from making red blood cells is because your body wants to try to make the red blood cells, it just can't.
When I go to the doctor, I have to get a needle, and it stays in my arm for about 6 hours.
A blood transfusion now to me doesn't seem like such a big deal.
My doctor day is not very scary. It has a few scary moments when the needle's going in. 1, 2, 3.
I'm scared. You scared?
The easiest way to help kids like Alex is to give blood regularly.
Sometimes we take for granted when we hear on the news that, or reading the newspaper, that there's a shortage of blood supply out there, and it's just it couldn't be more important to all of us who are able to give blood on a regular basis.
It's easy for me to come in here once a month and transfuse a patient with blood. But the real way that you need to understand this disease is think of your own child.
So I think it's really important to see someone else who you realize how appreciative you should be, and it makes you realize that, you know, giving back like that is it makes you feel great, and you know you're giving life literally to someone else.